Welcome back. The surge in COVID cases continues. The state set an all-time high for weekly cases, with more than 30,000 people testing positive just last week. Like nearly all other aspects of our lives, the pandemic has taken its toll on recovery. The disruption to daily life caused many to go into social isolation, limited access to recovery centers, and forced many into financial hardship. Overdose deaths were up 49% last year in Kentucky, likely an unintended consequence from the pandemic. I'm joined now by Secretary Eric Freelander, the head of Kentucky's Cabinet for Health and Family Services. Secretary, welcome.
Thank you. I appreciate being here.
If not for the pandemic, the drug epidemic in Kentucky would likely be the state's top health emergency. What is the state doing to make sure we don't lose sight of this immense problem?
Well, we've just had Overdose Awareness Day. September is Recovery Month. So we are trying to make sure that we keep a focus on overdose and overdose deaths in Kentucky. It is a tremendous challenge. We see it across our systems, in our child welfare system, in our healthcare system. This is and has been one of the top challenges for Kentucky for the past several years.
From what we understand, looking at the numbers, the pandemic has made the overdose death problem tragedy even worse. Would you agree? And how do you see it from that standpoint, with the pandemic combined with this epidemic of deaths with overdoses?
Absolutely. If you look at the past couple of years pre-pandemic, we were making some progress in Kentucky, but the overdose death rate has significantly gone up throughout the pandemic. And you know, it's an overused phrase. They talk about the perfect storm, but economic insecurity, isolation, these are all things that add significantly to the problems of overdoses and drug use, drug misuse. It is just the confluence of events that have made this so much worse. We were always in a delicate spot, but the pandemic has really, nobody wanted this, believe me, but the pandemic has certainly made things worse. There is no doubt about it. And what we have to do is redouble our efforts.
Groups like Addiction Recovery Care have been able to expand their services. Is that true with other groups? Are you seeing an expansion of recovery and beds and you know, that kind of help available?
Yes, and it's something that we support. We want to make sure that those services are more available across the state. When somebody gets to the point in their lives that they can acknowledge that they have a problem, you want to get them into treatment as quickly and efficiently as possible. So we want to make sure that all those options are available to people across Kentucky.
Looking forward, hopefully in the next year, this surge and the pandemic will be lifted somewhat or maybe a lot from our shoulders, from your shoulders. Do you look forward to that? And how will that affect what you're able to do moving forward on this particular issue with addiction and recovery?
If COVID has taught us anything, it is that whatever happens to one of us in our communities impacts us all. That's really true of a virus, but it's true of substance misuse and overdose as well. That impacts lives and families and all manner of businesses. So we need to all be in this fight together to really work on making sure that people can get treatment and services when they need it, so that they can recover, because recovery is possible. And this is a disease, just like heart disease or diabetes. This is a disease that we actually can treat. So we need to get people into treatment. We need to get people into those services. And what I hope is that when the pandemic is over, that can be what we work on in terms of our public messaging and talking to people like you and making sure that all our communities understand how important it is to get behind this effort.
Secretary Eric Freelander, the head of Kentucky's Cabinet for Health and Family Services, we appreciate your time.
Thank you.
Every year, thousands of babies in the U.S. are born addicted to drugs. A treatment center in Lawrence County is designed specifically to help expectant mothers.
Off the street and inside the walls of Addiction Recovery Care's Karen's Place Maternity Center, you'll find nearly 200 footprints hanging in the entryway. Each one doesn't just signify the birth of a baby, but the rebirth of a family.
Eventually, I just came to my rock bottom to where I realized if I was going to be able to keep my son and, him be healthy and happy, my pregnancy be good, I needed to come to treatment.
That rock bottom for Erica Letnosky was in the midst of a 13-year battle with meth when she found out she was pregnant with her fourth child. Her other children had already been taken away and placed in the foster care system because of her addiction.
I was homeless, was staying from place to place, abandoned places. I was in a very abusive relationship, also being pregnant.
Erica is just one of many mothers that have called the facility their home. The goal is to take in pregnant women and help them end their addiction. A clinical approach ultimately allowing their babies to be born not dependent on drugs. The National Institute of Children's Health Quality reports every 25 minutes a baby will be born dependent on illegal or prescription drugs. That breaks down to about 20,000 babies born addicted a year nationwide.
That's our goal, is teaching how to manage it so that you have it in that area where it's not going to trigger you to relapse, okay?
Mike Grider is a clinical counselor who has dedicated much of his career to helping people escape addiction. He says there's more to these women, and a fresh start is possible.
So many people may think of women in addiction who are pregnant, or women who don't care about their children, and that they're so self-absorbed and so lost in their own addiction, they don't care. But the truth is, the vast majority of these women desperately care about their children. And for many of them, that is the moment when they are so concerned about their baby that they will come and get help.
Grider says the biggest task is teaching these new moms how to be a mom, and most importantly, breaking the cycle of addiction.
So these children, many cases, you're breaking a generational pattern. And for some of these children, it's a first chance out of maybe 2 or 3 generations that a child can have an opportunity to have a truly good chance at having a healthy life.
I've been in all these girls' shoes.
Erica left drugs behind in 2019. She's now the lead peer support specialist at Karen's Place Maternity Center. Her job description is short and to the point. Use what she's been through to help other women build a family not supported by drugs.
And that's what I tell them, all the time. Like, I was you. I've been in your shoes, pregnant, feeling like, your life is horrible or nothing's going to get better. And so I try to encourage them that, it's absolutely possible.
Well, the Chrysalis House is Kentucky's oldest and largest licensed substance abuse treatment program for women. Its motto is building a community one family at a time. Chrysalis House specializes in treating pregnant women and women who are already parents. Joining us tonight is Connie Neal, Assistant Director, and Jessica White, Admissions and Transitions Director. Ladies, welcome.
Thank you.
Connie, for people that may not be familiar with Chrysalis House, it's been around a really long time. Tell me about the work that you guys do there.
The mission of Chrysalis House is to provide family-oriented treatment and recovery support for women with substance use disorders. We really are focused on treating women and in a holistic approach, and treating families as well. One of the things to think about when you think about women is that their issues are so much different from men, particularly pregnant women. Oftentimes they have a lot of trauma, and so that's one of the things that we really have to be aware of, is trauma and treating trauma. And we want to make sure that their traumatic experiences and their adverse childhood experiences don't get passed on to their children. And so we really want to focus on treating that entire family unit so that we can help them bond and be together and be successful in recovery.
How important is that you keep expectant moms once they have their baby, with their baby, if they're already parents? How important is that in the success of them getting through the program and getting out on the other side?
Well, we do know that, of course, it's so important for mothers and children to bond, and particularly for newborns to bond with their mothers. And so having moms be able to bring their newborns home with them from the hospital and to spend that time with them is so important. One of the things that women worry about when they're in treatment is who's taking care of their children. How are their children, particularly if they did have traumatic childhoods. And so for them to be able to know that their child is with them and that their child is safe and taken care of can really help her focus on her recovery and achieve the things that she needs to achieve so that she can be a good mom.
Jessica, we're still in the middle of this pandemic. Talk to me about how that changed your services, and then did you see a need grow more during the pandemic of women reaching out and saying, I need help, how do I get the help that I need?
Sure. At first, it was very difficult. A lot of services were closed. People were scared to be in community living, so it was really difficult to serve anybody at first. But here lately, the isolation has been really difficult. People are reaching out. It takes a lot of courage and strength to ask for help, and they finally are feeling a little more comfortable coming around, and we're seeing a lot.
You've got some residential services that are available to these women. Talk to me about what you offer in that way.
So women will live on campus with us, and their babies can stay with them too. Older children can visit on the weekends. We offer a lot of parenting courses, employment classes. We help, like Connie was saying, just the whole person, the whole family.
Connie, it's really important to make sure that that independence is still there, even when you're trying to battle and come out over addiction, isn't it?
Yes, it is. And that's one of the reasons why we offer recovery supports and life skills. Job readiness, helping them prepare. Most of our women don't have good work histories, and so helping them to prepare to get into the workforce. One of the main goals to help them come out on the other side is sustainability, self-sufficiency, to be able to take what they have learned at Chrysalis House and move forward and be able to support themselves and be independent.
Well, you've been doing this work for a really long time. I know it will continue. Thank you so much for your time.
Thank you.
Thank you.
Well, it is not just a battle for an individual. Addiction also takes a toll on the entire family. When we return, the story of one Kentucky family's journey from addiction to survival.